So in our previous webinar, what we covered was how to get started with medical cannabis. We talked about the qualifying conditions. We talked about your initial appointment, what documentation you need to bring to that particular appointment, and also how to get started, how to apply to the state registry, and what you need to visit a cannabis dispensary. Now, what we're going to cover this week is diving down into your actual cannabis journey. We're going to talk about the terminology that you'll encounter. As a beginner, we'll talk about terpenes, routes of administration. At your doctor's office, what you're going to need to, what terms you're going to run into, the application process, what terminology you're going to need to understand when you go to the dispensary, and then also during your journey, what terminology you'll need. Annie, let's jump into, first of all, definitions of cannabis. There are a lot of different definitions. I know that when putting this together, I found it interesting that there were what I call colloquial, practical, legal, and corporate definitions. You had some thoughts on this.
Yeah, absolutely. Working in a few dispensaries and in the field that I'm in now, having to keep up with all these terms, definitions, make a huge impact on how we can relate to a person. So knowing the legal definitions, practical definitions, colloquial and or slang, and the corporate definitions will really empower one person to be able to get the information that they're looking for to get on their journey.
So let's dive into what we mean by that. I think that we're covering that very quickly. And what we're going to talk about is, as we go through this, we're going to talk about the different ways they define those definitions when you begin, when you go to your doctor's office, when you apply, when you go to a dispensary, and again during your actual journey. And I might point out that there's a link here that you can go to and find a complete glossary of about 100 different terms in the medical cannabis world. So let's talk about, as a beginner to medical cannabis, what terminology we're going to run into. Manny, this is very interesting because there's a lot of different words that are used. Adult use, medical marijuana, low THC cannabis. Tell me a little bit about that.
Sure. So adult use is, as it suggests, recreational cannabis, meaning that you don't need a medical license. It's not being tracked. There's no seed to sale tracking by the state or the dispensaries. Medical marijuana is the opposite as to what I just mentioned. You're actually going to need a license from the state, a recommendation from the physician, and it is tracked the product itself from the seed all the way to the sale when the consumer receives it. Low THC cannabis is, as defined, less than 0.8% within the state of Florida of THC. And that's low THC, what some would consider CBD or high CBD products.
Now, dispensaries are where you actually can buy that medical cannabis product.
Absolutely. You could get other marijuana products elsewhere, but it won't be termed medical marijuana, and there won't be certain certificates or assurances with that product as you would get from a dispensary.
I think the main point we want to make here is we know the products coming from a dispensary are tested and are safe. On the street, you just don't know. And also, there's an important point about reciprocity, where in certain states, they actually recognize your medical marijuana card.
Absolutely. And it's very limited. They may not necessarily recognize the card except that you have one and allow you to purchase wherever that state may be. There may be differences in THC percentages that you're allowed to have because you have a medical marijuana card that is they use reciprocity on in a different state. But you just want to be cautious, do your due diligence and research before you go to that state, and possibly not travel with product if you're going to a state that offers reciprocity.
Yeah, what I find interesting is I've been able to use my medical marijuana card in a number of different states, as well as outside the United States. I use it in Jamaica, for example. But Florida doesn't recognize cards from any other place.
Correct.
But you definitely want to use your card. And your point about traveling with it, be very careful, because when you travel, you're getting into federal space. And again, it's an illegal product federally.
And I do just want to point out real quick, Mark, if I may, that dispensaries, you can only have a medical card to purchase at a dispensary, whether it's a lighter, whether it's rolling papers that you could get anywhere else without a card. If you're in a dispensary, you're going to need that medical marijuana license.
Now, we hear about hemp, cannabis, and marijuana. Tell me the difference between them, Danny.
Actually, they're all kind of the same thing, except as defined or appearance. It all kind of falls under marijuana or cannabis. But however, physical appearance, common uses, and legality terms make the difference. And so what I mean by that is usually marijuana is going to have medicinal effects with side effects or higher dosing being the high or euphoric effects, whereas hemp is usually made for industrial use, rope products and so forth, not usually medicinal use because it doesn't have all the cannabinoids. Physical appearance also makes a difference. Marijuana is usually shorter, bushy, fuzzy, thicker buds, whereas hemp is more streamlined, thinner leaves, more spacing between the nodes or where the branches meet, if you will. And then legality wise, marijuana contains more than 0.3%. That's the federal definition of THC, whereas in the state of Florida is 0.8% is considered low THC products. But that's really just the simple difference. It all falls under cannabis, however.
Yeah, and I think this is important. This is where we talked about the difference between the genetic definition and the legal definition. This is where this comes into play.
Absolutely. And then hemp is federally legalized with the hemp bill too, as well.
Now, let's talk about the main components of cannabis. They're really broken down into three parts: cannabinoids, terpenes, and flavonoids. This is very important because each of them has an important role to being able to help you with your medical cannabis journey.
Significantly, Mark. And these are just the three top categories, if you will, that are really diving into right now. Cannabinoids are what react with our CB1, CB2 receptors, our GPR, and our TRPV receptors. And those really have the medicinal properties that we're looking for, or the effect, if you will. Terpenes are going to be hydrocarbons that actually kind of drive that effect. Whether you want to be more uplifted during the day, more clear-minded, less euphoric, whether it's for pain, stress, anxiety. So that's where terpenes fall in, and your nose kind of delivers that effect. It actually has that aromatic effect. Flavonoids are just as important, but they're not as discussed just yet. They're compounds that contribute to the color, aroma, and taste, and they help drive those terpenes. So having all three of those is what gives you that entourage effect on the right.
An entourage effect simply means that working together, you get better medical benefits than by themselves. Find out. We'll talk a little bit more about that when we talk about the types of medical cannabis. But an entourage effect is something where this is really the reason why people use cannabis, because it enhances the medical benefits. So let's jump in a little bit to we hear about cannabinoids or cannabis. Really, there's two main products. There's two main cannabinoids: THC and CBD.
Absolutely, Mark. And THC is what most know. CBD was kind of late to the game in essence, but THC is found in cannabis just as CBD. It's the psychoactive or euphoric effects that most are familiar with or hear about, and it also reacts primarily with the CB1 receptors, which is found primarily in the brain and the central nervous system, like the spine. CBD is non-psychoactive. It actually kind of inhibits, or not kind of, it does inhibit the effects of THC, so it mitigates that euphoric effect, and it primarily targets the CB2 receptors, which are in our peripherals, our arms, our legs, our major organs throughout our trunk of our body. And that's why having a perfect combination, or as you suggested, the entourage effect of these products gives us our most beneficial homeostasis or balance within our body.
And CB1 receptors really work on the neurotransmitters, aka it helps a lot with pain. That's why THC is great for pain management. And CBD, which works very closely with the CB2 receptor, is really good for immune system and also for inflammation. And I think those are kind of the characteristics of those particular cannabinoids. And I do want to point out there are over 200 different cannabinoids that we've found. There's 120 of them being studied. So I'm not giving you a complete list. We're just giving you the kind of the overall view of the cannabinoids world that's really there. These are the two main ones you'll run into almost on it. Now, terpenes are really important because this is where you get the medical value. Manny, you have some specific thoughts about this.
I do. Terpenes is one of the major areas where I like to discuss, because a lot of people like to go after the THC percentage for effect, whereas that is important. It may not be as important as the terpenes that direct that effect and how strong it may be, or how intoxicating or euphoric it may be, depending on what you're getting. And those are three common terpenes that you see there: pinene, linalool, and myrcene. We'll dive a little deeper into that because as we go on, because it's not just a certain terpene you're looking for, it's a combination of them, kind of like you're looking for your special pizza, or especially your favorite spaghetti and meatball dish. You want that combination for that synergistic entourage effect.
And I should point out, I've been in this industry 10 years now. I've had people say, I'm using cannabis and it doesn't work. Well, when I go back and I look at what they're using and I look at the condition that they're trying to address, what they're using doesn't have the terpenes that address that particular condition. So it's very critical that you identify not only your medical condition, but also what terpenes work for that particular condition. And here's an example of the different terpenes that are out there over here. These are what I call the famous 8. These are the ones you'll find in a lot of different and most products. Tell me a little bit about these, because this is important for us.
Absolutely, Mark. So again, it's about the combination, or the formula, if you will, the recipe of these terpenes combined. I'm going to point out 3 primary, and then I'll go into other ones, because starting off, trying to figure it all out is going to be a little over inundating. So if there's three categories that we'll go into later of cannabis, such as indica, sativa, and hybrid. Sativa being uplifting, indica in the couch, and hybrid in the middle. And if you're looking for something during the day and you don't want to be too euphoric, you might want to find something where their primary terpene is limonene. If it's and limonene is going to help elevate the mood. It's going to relieve stress. You want to be careful not to combine it with pinene if you're suffering from anxiety, because that can kind of uplift you and induce stress combined, even though they both say they relieve it. Again, it goes to that formula. If you're looking for something for bedtime, more at night, or you need a little bit more intoxication and a body effect, something with linalool and or myrcene combined. Myrcene will probably be number one, with linalool somewhere really close behind. And then something for pain or something in between the day, but anything for pain, caryophyllene will be your primary in that. And depending on what orders those are in can dictate the effect of that product depending on the THC percentage. So again, when you look at this chart, it has a lot of great information, but you don't want to isolate just one terpene. You're looking for that formulation. Adding eucalyptol with limonene, linalool, and myrcene might be a great hybrid that gives you some clarity and help you write a book or get some taskings done because of eucalyptol in it. So it's all dependent on that. And the associates, the guys, the bud tenders are familiar with this, so you can ask about these as well.
And of course, you have humulene and terpenylene. Again, those are not commonly used words in the vocabulary, but you will run into them when you go to your dispensary. And these will help you with things like inflammation, antibacterial, antifungal. Actually, and humulene works as an appetite suppressant.
I was just going to say, depending on temperatures can dictate, as you see lower down there, you see low to medium heat, low heat, and it gives you those temperatures because they do have boiling points. So you want to make sure you're also using the right devices or the right methods for these.
And then terpenylene helps a lot with your mood. But these are the main ones you'll run into, but there's others that are there. Let's talk about terminology when you go to your actual doctor's office. Now, when you go to get a card, you hear about the qualifying conditions, that there are these 12 qualifying conditions. But Manny, candidly, if you don't have one of those qualifying conditions, you still can get a medical marijuana card.
Correct, because the state of Florida, as we suggest, has done something really good where they said if you have any conditions that are similar and or like to the qualifying conditions, then the physician or the doctor can actually use their determination to write the recommendation for you. It's not limited just to those specific. And point in case, the two main ones is chronic malignant pain. So if you're suffering from pain, that could kind of fall under that. Or if you're dealing with stress, anxiety, or depression, not all three combined, and you're not diagnosed with PTSD, those are symptoms that are similar and or like PTS or PTSD. Therefore, you can be qualified for a recommendation.
Manny, we hear about the fact that you get a recommendation, not a prescription. Can you tell me what the difference is?
Absolutely. So a recommendation, or I'll actually start with prescriptions. We're all familiar with prescriptions. We see the doctor writes the prescriptions that's filled at the pharmacy with a specific dose and a really detailed description on how to take that medicine, not drive, or you can't drive, take with food or otherwise. It's very direct and specific. And the doctors are held a little bit more liable to that because they're the one directing you how to take that prescription. Whereas a recommendation, they're saying, yes, I would recommend marijuana or medical marijuana for you for your symptoms or your diagnoses. And they recommend that you can get it, but they leave it to you on what to get, how to take it, the dosage, and everything in between. So it's not a prescription. It's not prescribed on how to take it. It's recommended to take it. And then hopefully journaling, which we'll get into, is being dictated by you so you can take notes and figure out the proper dose. Again, we'll go into that as well.
Yeah, and that's why dosing is so important, is because you want to be able to really home in on that particular product and concentration that'll help you with your medical condition. And candidly, this is something that's very, very important. In the state of Florida, they have possession limits. Why don't you cover that a little bit, Manny? I don't want to dive into what they are for each one, but give us a little overview of that, if you don't mind.
That's a great segue into the little gray area between a recommendation and a prescription, because although the physician is not prescribing you medical marijuana, they're recommending it, they are in a way prescribing the limits of what you can get within a 35 or 70-day window. You get the 5 routes of administration and then the 6th one as well. You have oral, sublingual, topical, edible, and inhalation, and then you have the smoking route. So you actually have 7, and there's limits limits per day that calculate the total amount you can get for the 70 or the 35 days, as it shows down there. Smoking is every 35 days. Every other route of administration or modality is going to be 70-day increment, but it continues, it reschedules on its own for up to 210 days.
We covered in the last webinar the difference between the yearly calendar and the two times 210 day. We covered that in the last webinar, so please refer to that to get some clarity if you're confused about that. Now, Manny, let's talk about, when we talk about the consumption methods, you made some good points, especially about inhalation. There's what they call onset, and there's what they call duration. Explain that to me a little bit, and it's different between each of the different categories.
It is. So, and if you go to a dispensary, what they'll describe it is fast in, fast out, or slow in, slow out. And what that means, for instance, like orals, when you ingest it, the onset is different because it's got to be metabolized, it's got to go through your gut, it's got to go through the first pass effect, if you will. And depending on each individual, their diet, their environment, what they're doing, their activity, that can change that onset from 30 minutes to 2 hours, possibly even longer. But since it's slow in, it's going to sit in the body. It's also a different molecule. It's not just delta 9. It's a THCH or something to that effect. I don't want to go too deep into that. But that's why you have different onsets and durations. Sublingual is going a little bit faster because it's in the mucosis of the mouth. So 15 to 30 minutes onset, but it still lasts a longer time. Then you have inhalation. That's almost immediate because it's going right into your lungs, straight into your blood system, and right into your CB1, CB2 receptors. So it's fast in. It can last anywhere from about an hour and a half to 6 hours. Again, depending on your metabolism, what you're doing, your activities. And I also want to point out that inhalation is dealing with anything that's not buds and or flower, as depending on how you know it. Inhalation is going to be processed products from the flower in order to be inhaled. Flower is going to fall under a smokable route. It's a little bit different. And then you also have topicals. Topicals will be immediate, depending if they're transdermal or not. Would mean if it gets into your bloodstream and you feel a full effect, or would it be isolated to that location? And there are topicals that will last anywhere from 2 to 72 hours.
Yeah, and that's really important. Now, let's actually get down into, when we say orals. Orals are the capsules and edibles. I want to point out something about orals. A lot of people hear about gummies, and gummies are great, but boy, remember that it takes anywhere between 30 minutes to 2 hours to work, maybe longer. You don't eat those things like Skittles. I mean, if they don't work after about 15 minutes or even after a half hour, even after an hour, don't take another one. Wait that 2 hours. That's safe to say?
Absolutely. And I would go a little bit further and say, follow the partitions of the products that you purchase. So not all gummies you can cut in half and in quarters because they're not all homogenized. So you don't know where that medicine is going to be. And the same thing with chocolates. They're going to be already partitioned to the proper dosage, which is usually 5 to 10 milligrams. You don't necessarily want to break that partition off and then cut that in half or in quarters.
Now, when we talk about sublingual, these are where you get into the tinctures and the sprays.
I was just going to say, yes, the tinctures and the sprays are in the mucosis of the mouth, so they're a little bit faster onset. They will last a little bit longer. They're easier to dose because they usually have a dropper, or one spray might be a certain amount of milligrams. And you can kind of titrate up low and slow, as we always recommend, so you can find that proper dosage.
And when we talk about inhalation, we're really talking about flower, vape pens, and concentrate.
Yes, it's a mode of inhalation, but it doesn't fall under the inhalation route. Flower will fall under smokable. But for the point of this being, inhalation is an immediate effect, whether it's a vape or flower. To that effect, yes, it's fast in, lasts about an hour to 3 hours, depending again on the doses you took and your environment.
And I do want to point out something that's really important. The question people have is why vape pens versus flower? You know, when you have that bud, you roll it into a joint, you're taking that joint and you're putting a 550-degree temperature, a flame, and lighting it. When you do that, you burn off half of the cannabinoids, almost all the terpenes, and almost all the flavonoids. So when you're smoking flower, you're really reducing the medical efficacy of cannabis down about 50%. That's the bad news. The good news is it works. It still is effective. So the reason why people use vape pens is because, first of all, you get the same effect, but also you're able to control the temperature. And by being able to control the temperature, you're being able to dial in the terpenes that you want. So for example, in my case, I'm trying to manage inflammation and also pain. So I set my vape pen 390 degrees. So that's where I get the best terpenes, the myrcenes, the beta caryophyllines really help me. I think that's the main difference.
I absolutely agree. And the last part to that is some people like discretion. Vapes are a little bit more discreet, a little bit more convenient. You don't have to roll anything, pack anything, or actually combust anything. So that's the only last tip I would put on that.
And then also concentrates are where they take the cannabis product and they make them into different different forms. They call them shatter rosin, distillates, but really what you're really doing is concentrating it. And it's not something that a lot of beginners get into, but I do know that when you do get into medical cannabis, concentrates are cost-effective ways of using medical cannabis. It's something that eventually, after you get started, you may want to take a look at. Tell me a little
Absolutely.
bit about transdermal patch, or tell me a little bit about topicals on the patch.
Yeah, so there's different topicals, there's patches, there's creams, there's salves, there's lotions, there's balms. All of these can or cannot be terpene infused as well, preferably terpene infused, so we have more direction with it. You have transdermal products that are topical, meaning that it actually gets through the water table of our skin into our bloodstream, and we feel an effect, a systemic effect. Whereas some are very localized, so it'll only help at the site where you're applying it. There is no systemic effect, which are great if you're still working, if you want to be out and about and you're concerned about intoxication or euphoric effect.
And these are very, very effective. The question then becomes, I know people worry about getting high using medical cannabis, and this is where dosing comes into place. This is where you really are looking for what they call your therapeutic dosing level. In other words, how tolerant are you to THC? In my particular case, I'm very tolerant to THC. But my wife isn't, and we have to be very careful about what she takes versus what I take. Tell me a little bit about this, because it's important to find out your therapeutic, your therapeutic dosing level.
Absolutely. So cannabis is biphasic, and exactly what it means is that too little, you get a subtherapeutic effect. Too much, toxic, meaning that you get effects that can induce your symptoms or make things worse. I do want to point out you will not die from it. There's no record of anybody overdosing from cannabis that's not been adulterated. So I just want to point that out. But finding that target range, it's almost like drinking. If you drink alcohol occasionally, you want to find that sweet spot. And the tricky part is that usually right when you're feeling so sweet is when you take that one more and it puts it slightly over. That's the little mistake that most people make when they're starting out. But now if you're journaling, which we highly recommend, you knew how much you took. So next time you could dial it back a little bit and hit that sweet spot. That's also going to maintain your tolerance. So that way you don't have to take as many holidays or tolerance breaks, which we'll get into later.
And again, like drinking, there's a point where you have maybe a drink or two if that's your level. But when you have the third drink, you get intoxicated. Same thing happens with cannabis. There's a certain amount that you take that you feel that relief. You feel that there's really no side effects, and you're really getting the medical benefits. And let me tell you, when you first start using cannabis, the mantra is go low and go slow. Start with just a little bit, increase it a little bit more each day until you find you're just going up this particular range right here, and you'll begin to actually get little or no relief. Then all of a sudden you begin to get relief. And in my case, where I have herniated discs in my neck, when the pain started going away, it was I knew it, and it was like, wow, this is very cool. But then when you take a little bit too much, again, as I'm going through that dosing thing, you kind of go, well, I'm getting a little buzz on. I think what I need to do is I need to back down a little bit, because I want to be able to work during the day and be able to get something done, but I don't want to be high. And I think knowing what that level is really important to you.
Absolutely. And finding that target range is so important because if you need to journal it, you want to know. And I also want to point out that most dispensaries will actually probably recommend inhalation first because it's fast in. If you don't like the effects or you take too much, it's only going to last approximately 2 to 3 hours at the most, usually a lot less. When you're ingesting product in orally or edibles or otherwise sublinguals, you really want to dose carefully because too much, you don't like that effect, it's going to stick with you for about 5 to 8 hours. The only thing that may bring that down is a high dose of CBD to mitigate the effects.
And I like to recommend tinctures, tincture oils when you start out, because you're able to control. This is a dropper that you put underneath your tongue. You can put a quarter of an eyedropper, half, three quarters. That's also another way of being able to start out and being able to control how much you're taking and knowing the effect. It's really good.
100%. If you're against inhalation for whatever your reasoning is, that's perfectly fine. Sublinguals would be my next recommendation.
If you do want to take a look at using the inhalation route, use a dry herb vaporizer. I think that's the best way of managing and being able to get the maximum effect out of the different terpenes that you're taking a look at. And we'll talk a little bit about that later. Manny, I'm in the process of getting started. Tell me a little bit about journaling. Now, I know there are some journals that are out there. Here's a link that you can go to find a couple of different journals. They tend to be rather, how should I say, detailed. But I know that the RN, Amy Green at MMTC, really recommends, just if you want to do something very simple, just take a look at the product and just journal on a daily basis, the product and the dose, the time that you took it, when the onset, when you began to feel it, and then how long it lasted. If you just do that, that'll help you quite a bit in understanding if medical cannabis is helping you. And I have to tell you, I had a knee replacement, a left knee replacement, and this helped me quite a bit because I realized I was started out by using a wrong combination of cannabis products. I had to adjust the ratios and the timing. And I found that by journaling, I was able to find out how to make that the most effective. This is a very important process.
100% important, and especially at the beginning, Mark. I still do it from time to time, even as a well-versed vet in cannabis, because there's so many products out there. And I love MMTC's example of journaling. It has all the information. A lot of it, if you just look at it, and if you haven't bought product before, you may be a little bit overwhelmed. But all that information that it's asking for is on your product, so it's very easy to track. And once you get a good idea of where you're at, you probably will stop journaling for a little while until you run into something new. And there's also apps out there that you can use if you're not a pen and paper type of person. But I highly recommend journaling and finding that target range.
Yeah, I know it's very effective for me, especially in managing my knee operation. Now, titration is the method in which you really you raise. This is the process here. We're using a little bit more as you're going along. It's really using a little bit more each day until you really find that relief level. And then once you get to that level, you'll know you're there. You'll also know when you go over a little bit. I'm going to a half an eyedropper to 3/4 of an eyedropper, and I find out that when I go to 3/4 of an eyedropper, I get a bit of a buzz on. So I'm able to back down and know exactly where I want to be. And I think this is important for people to understand. Knowing your therapeutic dosing level is really the key, getting the maximum benefit out of cannabis, and also cost effectively, not using too much effort.
Absolutely. And then when you're journaling, you'll also find that you may end up using multiple products at the same time, Mark. You could use
Good
a
point.
topical with a vape. You got to go to work, so you can't step out to smoke or vape or use your product all the time. So you could use an edible instead, a low dose or ratio product edible, which we'll dive into here soon.
And your therapeutic, your target, and your toxic ranges are all different for every person. There is no golden formula that's out there. So now let's talk about the terminology that we'll use while we're applying for a card. Now, Manny, there's something called the Florida Office of Medical Marijuana Use, the OMMU. They're the ones who really regulate and manage cannabis. But really, there's a couple of key points here. Tell me a little bit about the patient ID, caregiver, and some of the different forms that are there.
Sure. So the patient ID card application gets initiated by the physician. So you would see your physician first. You get approved for a recommendation. They take your demographics, they put it into the system. The state receives that, and then they reply to the applicant or the patient with an email to continue the application process and make their payment. If you're a Florida resident, you can get instantly approved as long as your license and all your demographic information is up to date and registered with the state. There's a $77.75 fee that's include the convenience fee they tack on, and then you'll get your card within 10 business days, give or take, but you're immediately approved. You have an email with your patient ID, and you could go immediately to a dispensary and purchase.
Yeah, that patient ID is called your patient number, and your doctor will give that to you on the visit. If you have all the documentation in line.
And then your caregiver ID, if you need a caregiver, there's a new process that was implemented that they have to be a close living relative, son, father, something to that effect, spouse, where they don't have to go through a background check. Otherwise, if it's not a close living relative, they have to go through a background check that could take 7 to 10 business days, depending on the applicant, because I believe they would have to get fingerprinted as well. But what the caregiver card does allow is that person to purchase and do everything on behalf of the patient. Unlike if you're married, you could go to a pharmacy and pick up medication for your spouse without having a caregiver card. In the medical marijuana industry in Florida, you would have to have a caregiver card, even to sit necessarily on a consultation with your loved one or your relative at a dispensary, because they don't want liability. And that's a little bit of a process, but most clinics will walk you through it as MMTC does.
And then also there's some change recommendations and surrender request form.
Absolutely. So if you have any changes, usually you could request through your physician first, see if your physician has anything that you request to change, like demographics. Otherwise, you would submit the change replacement card or surrender request form through the MMUR. Keep in mind that the clinics are not the approving authority. All they do is submit the recommendations. So anything pretty much thereafter would be submitted through the Medical Marijuana Use Registry, or MMUR as we call it. And I do believe that if you submit a surrender request form, it does drop you from the MMUR system. But again, that all has to be submitted through them.
Let's talk about a little bit about caregivers, because this is really important.
Yes. So caregivers in Florida must be a Florida resident, must be 21 years old, not a medical marijuana physician to avoid impropriety. not be employed or have economic interest in medical marijuana treatment center, aka a dispensary. And a little note on that, no matter what you do for a dispensary, as it seems right now, you may not be able to be a caregiver, whether you work in it, for it, doesn't matter. I have had close encounters with that for my son, so that's why I mentioned that. Be very aware of that. Successfully complete the caregiver certification course every 2 years. There is a study guide on the OMMU webpage that you can look through before taking that test. Obtain and be in immediate possession of a medical marijuana use registry caregiver ID card. That applies for even patients. You are to maintain that card on your person in order to purchase or show proof why you have product on you. Although most people or most law enforcement in Florida will accept your license, your driver's license or state ID, because they can look you up that way, and not receive compensation for being a caregiver. So you can't charge people to be their caregiver.
Let's jump a little bit into the terminology that when you go to a medical marijuana dispensary, what are you going to hear about? Manny, this is right up your alley. Tell me a little bit about this.
Yeah, so everybody is pretty much familiar with the three main categories of cannabis, and that's indica, sativa, hybrid. Indica is short for cannabis indica, and it's most people know it as in the couch. So most indica category products are going to be relaxing, if not very sedative. Then you have the sativa category. Most people use an analogy or metaphor of sativia, the sugar substitute. So it's uplifting or somewhere balanced, not really meant for nighttime to go to sleep if you want to relax. And then you have hybrid, which is right in the middle. Now, then again, I want to mention these are very broad categories. That's like saying red wine, white wine, and rosé. You still have bitter, sweet, dry, and so forth. So this gets you in the general area of it. And then you would have that conversation with your bud tender or your guide or associate to guide you further in. And then down there, I wanted to point out Rick Simpson oil, also known as full spectrum oil. What that is,
FSO, yeah.
yeah, that's the whole plant basically in a tube. It's not meant to be inhaled depending on how it's refined, but I always throw caution to the wind and say, hey, do not inhale FSO because it can actually induce inflammation of the lungs because of all the product that's in there. They didn't really filter anything out, just made it more as a topical or an oral edible and more convenient that way.
And I've seen some tinctures that have come out, RSO tinctures that have come out lately.
Yeah, they're making it a lot easier. It used to be very thick, very sticky, very hard to handle. Now they're diluting it in tincture oils with olive oil or MCT oil, multi-chain triglyceride for balance. And it's more effective because you can actually dose properly with it and not be too concerned about over indulging on it and getting beyond that toxic range of your biphasic effect.
And I'm a big fan of RSO. I mean, I think the whole plant really helps you on a lot of different cases. I know it's something that at least helps me quite a bit and something that I use on a regular basis. Now I have to tell you, I like the tincture version versus the syringe version. It's just because it is sticky. I like to make it simple for myself. Now let me talk about something else, if you don't mind. In the CBD world, there's what they call broad spectrum and full spectrum. When they make the CBD products, they're trying to make it so that when they take the CBD product, if they try to contain no THC or try to get the minimum amount of THC in it, that's called a broad spectrum product. And then of course there are full spectrum products that have 0.3% THC or less. Why would I buy a full spectrum product versus a broad spectrum product? Because by adding that little bit of a touch of THC, it actually boosts the effectiveness of CBD. In other words, it really enhances not only the capability to manage or to control inflammation, but also helps with pain management. So I'm a big fan of using full spectrum CBD as opposed to broad spectrum CBD, but there are two different versions that are out there. And again, some people who just want to stay away from THC altogether, take a look at your full broad spectrum product. That'll help you quite a bit. So, Manny, there are product terms that we hear about: ratios, cultivars, onset durations. Tell me a little bit about this because this can be confusing.
It very much can. And I'll just start with ratio of products as defined by its content ratio of CBD to THC as stated in Florida. So that first number is going to be your CBD. Second number is going to be THC. So for instance, that 1-to-1 is perfectly balanced. Is going to be like a hybrid category strain or cultivar. That 1-to-9 is going to be a very strong high THC product. And that 12-to-1 is going to be a very high CBD product. The reason I like ratio products, not necessarily as opposed to cultivars or strains, is because the only difference is that it's formulated, so it's consistent. That same product is going to have the same effect every single time. Cultivars or strains are tied to that specific species of that plant and how they were cultivated. And the difference is that that strain or that cultivar could change from batch to batch, only by a few percentages, but those few percentage numbers can actually have an impact on the efficacy or the onset or the duration of the product. And ratio products come just like the strains do. They could come in different forms. They could come in oral, sublinguals, topicals, or edibles, whereas the cultivars are going to be more specific and can vary, again, as I mentioned.
Now, there's also been other terms that come up that confuse people. They're the buds, distillates, edibles, pre-rolls, dabbing. This is really diving down into it.
It is. Bud, you'll probably hear more as a term of flower in the dispensaries. All these other products, the distillate, edibles, pre-rolls, dabbing, everything else, ratio products, actually comes from the bud or the flower. And then it's processed into a certain way or modality to be consumed depending on what the consumer or the patient needs. So bud is the flower. Distillates is refined high potent cannabis concentrate that has been stripped of all the cannabinoids and then except the THC, and then they may invite terpenes and stuff like that into a formulation, not necessarily a ratio product. Edibles are just as they sound, that edibles, and are cannabis infused. Not all edibles are going to be homogenized. So as I mentioned before, you're going to want to follow the partitions that are there, whether they're 5 or 10 milligram partitions. Pre-rolls is the grounded up bud that are already pre-rolled for you. So you can just pop the tube, pull out the pre-roll. You don't have to do anything else but light it and then go ahead and consume it. And then dabbing refers to the consumption of concentrates, meaning it's a distillate or some other type of concentrate, shatter, wax. There's so many that you would actually need a device that you can set to a specific temperature in order to dab it. You would drop the concentrate into the bowl or whatever device you have, and it would vaporize it at a very high temperature, meaning you're hitting different cannabinoids, different terpenes for a different, usually more potent effect.
And the reason that people dab is because you can set the temperature ranges on most of these dabbing devices. And so you can home right in on the terpenes that you need to be able to address your particular medical condition. So it's something that people who are in the medical cannabis world, when they start out, dabbing is not what they look into. But as you get a couple of months under your belt, maybe even 6 months or a year, you might want to take a look at dabbing because it's a very effective and cost-effective way of using cannabis. And there's a link to being able to find more information about this.
Just be very cautious, as dabbing can also really spike your tolerance.
Yeah, that's really true. Please consult someone who knows about dabbing before you dive into it. But it is effective. I dab on quite a bit. I like it. But again, it took me about a year, almost a year and a half before I jumped into that. Let's talk about the terminology that we'll use while we're on our journey. I know that one of the big things that comes up is what they call the certificate analysis. This is critical.
100%, because this is going to tell you everything you need to know about the product. It'll also allow you to determine the efficacy of the product. So route of administration is going to be the modality that this product qualifies for. So not all dispensaries are going to have certain edibles under oral or edible or sublingual. It all depends on how they submitted that application to the state, but you'll be able to see that. The product type, which is it a flower? Is it a concentrate? Is it a topical? The potency is not just the THC. It also encompasses the terpene content. So as you see on that demonstration, you see that high percentage of delta-9 THC, then you have CBD, CBN, THCA, but then to the right, you also have the terpene percentages. And even though the total of those terpene percentages is about 4.73 to 5%, that little percentage has a huge impact. And you can see the order in which those terpenes come in to help you find out the dictation of that product and how it's going to affect you. So these are just a few of the terminologies that the dispensaries are going to be familiar with. They are also familiar with the colloquial and slang terms, the medical terms as well.
Yeah, and I should point out the certificate analysis is available from every dispensary. They have a COA or a certificate of analysis for every product, and you have the right to ask for it and for them to show you that particular product so you know what you're buying before you actually make the purchase. I think that's really, really important. I think this is something that you've run into quite a bit, Manny.
Yes, and COAs have become more prominent at dispensaries. Some will have it available online to click on. Others, you just have to request it. They'll print it out, or you can trust them to read it off to you. And this is a great learning point, especially at the beginning, so you can decipher what works for you. But to your point, Mark, it is mandatory that every product has a certificate of analysis from seed all the way to the consumer. And the caveat to that is that this is ever changing. So if they don't have it right away or can't print it right in that moment, they have to be able to print it for you before you make the purchase.
And the last point I'd like to make is, although that terpene percentage looks very small. These are very powerful. These are very potent little, let's just say, medical ingredients. So don't be put off by the low percentage. This is something that's really, really important that's there. Now, let's talk a little bit about how do I know if I have these limits? How do I know if I can buy a product?
That'd be a great question. And at the beginning of your journey, when you're with the physician and they put in the recommendation, 9 times out of 10, 10 out of 10 for MMTC will guide you through the application process and how to use the MMUR. Basically, this is your insight to your pharmacy to see what you have remaining, when you need to renew, what has been dispensed. You can see everything here. You just have to take the time to go in and take a look at it. There's really nothing you can do in there to mess anything up other than track your progress and make inquiries where necessary to make sure that you're on track.
Right. Now, this particular form you get when you get your medical marijuana card, you get an account with the OMMU, and this is available in that particular account.
Yes, it's the first thing you'll see when you complete your application process. And if you're a Florida resident, you'll be immediately approved, and you'll automatically see your limitations, when it will expire, or when the new one is scheduled to start, and so forth.
So, Manny, we covered a lot of topics and we covered a lot of ground. Let's talk about the fact that you can get patient education in a lot of different areas. One of the main areas is not only listening to webinars like we have today, which is going to Marijuana Aware, but also we have a YouTube channel. If you go to YouTube/Marijuana Aware, we have a number of videos out there broken down by categories on how to get started, the different conditions, questions and answers, things like that. This is a good resource for you to be able to look at and be able to find out information on how to use medical cannabis. And also, if you're looking at getting a medical marijuana card, we have the Medical Marijuana Treatment Clinic of Florida. I highly recommend them. I think there are 22 locations here in Florida, and they do a very good job of being able to really help you walk you through this particular journey. Any final thoughts you have, Manny?
I would just suggest, as watching this webinar, thank you, and do your research. There's a lot of rabbit holes out there. These are great resources. Take the time, ask the questions you want to ask. Don't be embarrassed. Just like if you were in the doctor's office, you will be to get your medical marijuana card. And reach out if you have any questions. Please, we're here to help.
And I think it's important to point out this is the second video. We're going to be coming up with the next video. It's going to be done. We're going to talk about methods of using medical cannabis, how to craft a treatment plan for yourself. And we talk about the different conditions it addresses, how to manage edibles, in fact, how to cook with it. We're going to have a very special webinar that's going to talk about how cannabis can help veterans. And then we're going to wrap up the quarter by talking about just having all the frequently asked questions and being able to let people ask questions at random. I also want to point out that on the 6th of February, we're going to have a live seminar in the villages. Please feel free to join us. This is where Manny and I will be actually meet us in person, and we'll be covering understanding cannabis as medicine and answering your questions.
Looking forward to that, Mark.
Yeah, that's always a fun seminar, and we look forward to potentially meeting some of you. I want to thank you all for watching this webinar. Very, very important that we understand what you need. So please feel free to give us feedback on this. And also, hopefully, this webinar helps you get your life back. Thank you for joining us.